So yes, now we can start the session of High Yield Anatomy MCQ session 1. So this is the Anatomy MCQ series. So we will discuss here. The 7:30 p.m. timing is dedicated to the discussion of Anatomy MCQs. Myself, Dr. Monalisa. Now before starting the session, I would like to give a quick quick introduction of myself. I have done my MD Anatomy from Armed Force Medical College, Pune. And my referral code is ANAT10, which can be used by you if you want to take the subscription of Unacademy. So now the free live sessions on the Unacademy platform. So for this, if you want to be the part of free live sessions on the Unacademy platform, you have to use the code ANAT10 for unlocking free sessions, and also this code can be utilized by you for taking the plus subscription of Unacademy. Now before starting the session, and still students are joining, I would like to just brief you about my upcoming sessions. So this month's timetable I want to update. Now I have dedicated YouTube session 7:30 p.m. timing to that of MCQ session only. I am continuing with this. Here every day I will discuss, the session will be short and crisp, 30 minutes or 40 minutes maximum, and we will discuss 5, sometimes 8, 9. So daily MCQs session will go on. And if we talk about the conceptual anatomy, now few topics the students has asked me to explain here. So this is 11:30 a.m. timing. So few topics which I want to give you the brief, I will discuss that. High Yield Anatomy MCQ sessions. This is the session of 9 p.m. So again, I am also taking a High Yield Anatomy MCQ series on the platform of Unacademy. 9 p.m. is the timing, and again conceptual anatomy topics are also being taken on the Unacademy platform, that is 6 p.m. time. So this is the schedule of mine, and this is how we will proceed. This is the code, that is ANAT10, which can be used if you want to be the plus subscriber of Unacademy. So yeah, now this is the whole session. This is the part 1, part 2, 3, 4, 5, 6, 7 and 8. These are the sessions of my anatomy MCQs on 9 p.m. timing on the special classes, which is absolutely free. You can join the session. Conceptual anatomy sessions, which is absolutely free. You can again join the session. 6 p.m. is the timing. Okay, 4 sessions I have described now, that is flexor and extensor retinaculum was taken today, venous drainage of lower limb, lymphatic drainage and lower limb MCQs. Now let's start with the MCQ detail now. So let's start with the first MCQ. So all of you, so few students have joined. Yeah. So let's start with the MCQ session. While exposing the kidney from behind, so when we are exposing the kidney from behind, all of the following nerves are liable to injure except. So 4 options are there, students, and you have to mark the correct answer when you are exposing the kidney from behind, the structures or the nerves which are injured except. So 4 options are there. Option A, lateral cutaneous nerve of thigh. Option B, ilioinguinal nerve. Option C, subcostal nerve. Option D, iliohypogastric nerve. So you can give your answer. I will wait for 30 seconds and then I will proceed with the answer explanation. Yeah. So 4 options are there. Mark the correct answer. Yeah. So yes, any of the answer. Okay, I got answer. Mohammed is telling Mohammed Noor is telling C is the correct answer. Okay. So what about others? What about others? What about others? Okay, so Shweta is also telling C is the correct answer. C is the correct answer. Okay, and Harini is also telling C is the correct answer. Praveen Sinha is telling D as the correct answer. Praveen Sinha is telling D as the correct answer. So let me come up with the explanation of these MCQs. Okay, actually the correct answer that is given by most, so again D is coming as the answer. So let me explain the correct answer now. So C and D, that is the answer given by the students and aspirants. Okay, I also got A as the correct answer. Actually the correct answer is C. Okay, actually the correct answer is not C or D, it's the A. Okay, so I was just waiting when our exposing, okay, when we are talking of exposing the kidney from behind, all of the following: lateral cutaneous nerve of thigh is not going to be involved when we are talking about posterior aspect. So yes, I got C, D and A. So Hanuman Yadav has given absolutely right answer. A is the correct answer. Okay. So let's come with the explanation. So in brief, firstly I want to explain and then I will give you the notes also, don't worry about it. So let me show you this diagram. So all of you, can you see this diagram? So actually the option was nerves. In the option there was subcostal nerve given. Okay, let me just see the options. Yeah, subcostal nerve was C, that is absolutely lying in posterior relation. Ilioinguinal and iliohypogastric is also correct. Now see here, this is the diagram where you can see the kidney posterior aspect from the, let me slightly enlarge this diagram. So is it clear? Now see, here is the right and the left kidney as shown in the diagram, and what you can appreciate, the posterior relation of three nerves as we move from above to down. The first nerve is subcostal nerve and vessels. Okay, then we have got also the iliohypogastric nerve and ilioinguinal nerve. Okay, so three nerves which is related posteriorly as shown in the diagram. This is the subcostal nerve, then iliohypogastric and then ilioinguinal, which I am highlighting also. So no doubt that these three nerves are posteriorly related. So is it okay everyone? So subcostal nerve, ilioinguinal, iliohypogastric nerves are lying in the posterior relation, and also we can see that 11th and 12th rib. So 11th and 12th rib is related on the posterior aspect of kidney in case of left kidney, but in right kidney it's only the 12th rib. It's only the 12th rib. Why? Because on right hand side the heavy structure liver is lying and the muscle which is related. So we can also appreciate the muscle. We have got medially psoas major, quadratus lumborum and transverse abdominis muscles are related, and on the upper posterior aspect the diaphragm fibers. Diaphragm is also seen in relation. So this is the view which is showing the relation of posterior aspect of both the kidneys. So don't worry, let me just write this detail. Okay. So so we have got Hanuman Yadav absolutely right. So please write these details everyone. Okay, so write on posterior relation of kidney. So mainly on the posterior aspect we have just seen that it is related to diaphragm. To be more specific, it is related to diaphragm and also related posteriorly to two ligaments in relation to diaphragm, that is medial and lateral arcuate ligament. So it is related to medial and that of lateral arcuate ligament. Okay. Now coming to the list of muscles which is related posteriorly. The muscles which is related posteriorly are following: psoas major muscle, quadratus lumborum, transverse abdominis muscle. Now nerves and vessels, posterior relation nerves and vessels which is related posteriorly, nerves and vessels. The nerves and vessels which is posteriorly related are subcostal nerves, and we have got subcostal nerves and we have got subcostal vessels. We have got iliohypogastric and ilioinguinal nerve. Ilioinguinal nerve. So ilioinguinal nerve. So this is okay. So those who are knowing the facts, nothing to worry. If they have forgotten it, you can just keep a notebook aside and you can write the notes along with me. And what about the ribs? So we have got 11th and 12th rib, both related onto the posterior aspect of left kidney, and when we are seeing the right kidney, only the 12th rib. It's related only to the 12th rib. So yes, let's move on to the next MCQ, that is MCQ number 2. So is it okay everyone? Any doubt? So let's move on to the next one, that is question number 2. So all of you just mark your correct answer. Periosteum is attached to the bone. Periosteum is attached to the bone by following structures. What are this? So which is the most correct? Purkinje fibers, Sarpes fibers, elastic fibers, peripheral lamella. So according to you, which is the correct answer? Mark your answers. Perosteum is attached to the bone by which of the following? Whether it is peripheral lamella, whether it is Sarpes fiber, whether it is elastic fibers, whether it is Purkinje fibers. So, according to you, which is the correct answer? So, yes, Abdul Qadir has given the answer as B. Okay, what about others? Try to answer, otherwise I will hear for the explanation, don't worry. So, yes, Harini is telling it's B. Okay. Okay. So, can I come up with the explanation? The correct answer here is, if we talk about the perosteum being attached to the bone, the correct answer is, my dear friends, it's B. Yes, few of you have given the right answer, that is Sarpes fiber. Actually, on the outer aspect of the bone, there is a covering that is called as perosteum. Okay, this perosteum is having external and inner layers. Okay, so yes, the external layer is a fibrous layer and the inner is osteogenic layer. So, and the perosteum is very important covering which is lying on the bone. It is having blood vessels, lymphatics, nerves attached to it, and it is attaching to the interior of the bone via Sarpes fiber. So, write down everyone, this is an important fact known to be everyone. Exterior of the bone is covered by perosteum, and this perosteum again has got two layers. The external layer of perosteum is fibrous and the inner layer of perosteum is, when we talk about the inner layer, it is osteogenic, giving rise to osteoblast. Okay. Now, in the perosteum there lies blood vessels, there lies lymphatics, there lies nerves, there lies so these are the structure which is traversing through the perosteum, and then it has to move inside the bone. Okay, it has to go inside. So, attaching to the bone, there the perosteum and the connection of the interior of the bone occurs via Sarpes fiber. So, it is also called as anchoring fibers. Anchoring fibers. So, Sarpes fiber is also called as anchoring fibers, and it is also called as perforating fibers. It is also called as bone fibers. So, please do not get confused with this term. If I tell Sarpes fibers, the different common names which is given to it is anchoring fibers, it is also called as perforating fibers, it is also called as bone fibers, and it is actually derived from the perosteum and it is traversing inside the bone. Okay. It's actually it's a perforating fibers through which and it is composed of fibers that is made of connective tissue collagen bundles. So, please write down the details of the Sarpes fibers. Firstly, I would like to show you this diagram. So, everyone, the diagram is clear. Is the diagram clear? Okay. Now, here what you can appreciate, the diagram is showing the Sarpes fiber, and here you can appreciate the Sarpes fibers. Let me show the Sarpes fibers by this color. Okay, can you see, these are the Sarpes fibers which is shown, and what is the layer from which it is derived? It is derived from the outer aspect covering of the bone, that is called as the perosteum, and from the perosteum the fibers are entering. These perforating fibers are is piercing and going inside the matrix of connective tissue formed of collagen fibers and connecting the bone. It forms a connecting link between the bone interior and the perosteum. So, all of you please note down this point. Sarpes fiber as shown in the diagram. If you want, I will show the diagram once more, which is also called as bone fiber, which is also called as perforating fibers. It is also called as perforating fibers, and it is actually made of bundles of collagen fibers, And what is the function? It acts as a connecting link. So, my dear friends, it is acting as a connecting link between the bone and the periosteum. Bone and the periosteum. Now, so what happens? It is acting as a connecting link between the bone and the periosteum. Yeah. So, now what happens? Inside the bone there is laminas, okay. So, the other option which was given was inside the bone there is lamina, okay. There the lamina has got different structure. It is in the form of circumferential lamina, it is in the form of interstitial lamina. So, the other option, so let us rule out the other option. So, this is the fibers, this is the connecting link which I have shown, okay. The Sarpes fibers has been shown here forming a connecting link with the interior, and here also you can see the laminas here, canalicles, osteons are there, and these circular shape structures which is lying inside, they are all concentric lamina, okay. Outermost part here, so see here, the outermost here, these will be the circumferential lamina, this circle part will be the concentric lamina, okay, circumferential concentric, and this part which is lying, these laminas which is lying inside in between the two osteon, this part will be the interstitial lamina, okay, that is lying between two, you can say two rounded structures, which is also called as, what is the structural unit? If we talk about histological structure unit of the bone, that is formed by osteon, and osteon is having in the center Haverian canal, and whole of Haverian canal surrounded by laminas, and in this lamina lies the space that is called as lacunae, and that is containing osteoblast, and mature osteoblasts are called as osteocytes, okay. So, that is one osteon, that is also called as Haverian system, and this canal which you are seeing is the Haverian canal through which blood vessels, nerves and rest traverses. That is Moni name for ones, okay, okay. So, that is how it happens. So, yes, we have done with this. Now, yeah, so peripheral lamina can't be the answer. Purkinje fibers is not seen here, they are mainly neuronal, and elastic fibers are mainly seen in elastic arteries. It is seen in the structures which is giving ligamentum nuchae like this elasticity. So, the correct answer here will be B, Sarpes fibers. So, I think most of the students has given the right answer. Okay. So, now let us move on to the next MCQ. Everyone is ready for the next MCQ? Okay. So, let us start with the next one. Okay. Fundus of gallbladder lies at the angle between lateral border of rectus abdominis and tip of 9th costal cartilage. So, the vertebral level is lower border of which of the following points, whether it is T12, T11, D2, means the second lumbar or the first lumbar. So, according to you, which is the correct answer? 4 options are there, A, B, C and D, and mark the correct answer. So, everyone, I will give you 30 seconds for marking the correct answer, and just mark it. Okay. Question number 3. Okay, so 3C, ma'am. Kumaran is telling it's C. Okay, L1. So, Kumaran has telling it's C along with a question mark. Shweta is telling it's A, T11. What about others? Hardinge is telling it's D, okay, L2. So, mixed bundle of answers are coming. So, I have got A also as the answer, I have got C also as the answer, I am getting D also as the answer. What about others? Okay. So let me explain it. Fundus of gallbladder lies in an angle between lateral border of rectus abdominis and tip of ninth costal cartilage. So we have to know about the vertebral level. Actually the correct answer is C, and all of you must be knowing, most of you, that at the level of pyloric plane, which is the transpyloric plane, very important structures lies. So one of it is the fundus of gallbladder, okay, that is lying. So transpyloric plane is an important plane which we see when we were studying the abdomen anterior aspect and when we were studying with the introduction part of the abdomen quadrant and all. So this is exactly, the transpyloric plane is lying midway between the xiphoid process of the sternum, and it's going downwards, passing through the level of the L1 vertebra, okay. So let me just explain it, and many important structures passes through the transpyloric plane. So actually the hint was like when if you are knowing the transpyloric plane corresponds to which level, then it is corresponding to which vertebral level, L1. So one of the structure is fundus of gallbladder. Other than that, many important structure, pylorus of the stomach, hilum of the left kidney, also the part of duodenum, horizontal part, neck of pancreas. At this level only formation of portal vein occurs, superior mesenteric artery and vessels. So all these structures are important structures located at the level of L1, and also fundus of gallbladder is lying at the level of L1. So please write on that list. So first thing is that it is important to know the anatomical location of fundus of gallbladder. Fundus of gallbladder is located in angle between, it is located in an angle between the costal margin and lateral margin of rectus abdominis muscle. Which muscle? Rectus abdominis muscle. Lateral margin of rectus abdominis muscle. Okay, written. Now, exact plane on which the fundus of gallbladder is situated, just now we have seen it's lying on which plane? It's lying on the transpyloric plane. Now, so this is how we approach to the right answer, but it is also important that we should know all important structures lying in the transpyloric plane. What I have seen in the previous year MCQs, one or two times in the recent last 4 or 5 years, I have seen that they have asked in different examination about the structures traversing or located at the level of transpyloric plane. So please write down that also, important structures. Structures lying or located at the level of transpyloric plane. What are the structures? So it's important to know the details of important structures lying there. The level is L1 if we talk about the lumbar level, and also it is exactly at the level of ninth costal cartilage. So it also corresponds to the level of ninth costal cartilage anteriorly, ninth costal cartilage, and posteriorly the level is L1. The structures passing through it is following structures. Pylorus of the stomach is located at this level. Hilum of left kidney, also corresponding structure is neck of pancreas, So continuing with the list. So I would like to write here important structures. Part of duodenum, horizontal part of duodenum. Superior mesenteric vessel. So neck of pancreas, that means formation of portal vein. So at the level posterior portal vein is also formed at this level by joining superior mesenteric vein and that of splenic vein. Okay. Other than that, right and the left colic flexor is also located at this level. Right and the left colic flexor. Lower border of spleen. Lower border of spleen. Okay, so these are certain important structures, and also actually the cisterna chyli. Not exactly the termination of the spinal cord occurs here, but in between L1 and L2, so this is the level corresponding to L1. So just below here, termination of the spinal cord is also there. Okay. So these are certain structures which is located at this level, and yes, fundus of gallbladder is the important structure. Fundus of gallbladder. These are the certain landmarks which you should remember located at the level of transpyloric plane. So yes, can we move on to the next MCQ, everyone? Also, root of transverse colon is lying here. Root of transverse colon. So I have enlisted important points lying over the transpyloric plane. So done. Let's move on to the next MCQ. All of you. Okay. Before that, I just want to give you few details of the platform of Unacademy. Iconic subscription is there. So those who want to be the part of plus subscription of Unacademy account and also with the prep ladder part. So yes, sure, Kumaran. They can use this code ANAT10 for unlocking the free session and also for taking the subscription. So they can be this is both way beneficial, because you can take the benefit of prep ladder along with the live classes on the Unacademy platform, and every fourth session on the plus platform of Unacademy is a doubt clearing session. So all the educators, different subject has got 2 to 3 educators of that subject specialist. So you can directly interact with them, ask your doubts directly in the class, be the part of the session, and you can have the course in a structured manner. So you can take the subscription, and if you want to take the subscription of 3 months, you will get an additional 1 month of subscription absolutely free. If you want to take the subscription of 12 months, additional 2 months of subscription is absolutely free. Download the Unacademy app, then you have to search for NEET PG as your goal, then you have to search for NEET PG subscription, whichever subscription suits you, whether you want a preparation of 1 year, you want a preparation of 2 years, if you want a preparation of 3 years, you have got enough time, you are in second, third year, first year, or you want to be the part of quick revision 3 months, 4 months, 6 months, whichever suits you, you can be the part of that session. Also, you can use the referral code ANAT10 for taking the subscription, and you can be the part of upcoming sessions. So upcoming sessions are NEET PG session batches which is coming up. So whichever session suits you, you can be the part of these session. FMGE MCQ marathon batches is coming up. Also the INICT MCQ marathon batch is coming up. Target Next 2022 batch is coming up. So you can be the part of these session. Let's start with the 4th MCQ. Okay. So done. That was an introduction of all upcoming sessions about Unacademy platform. So let's solve the next MCQ. So all of you, the accessory obturator artery is a branch of accessory obturator artery is a branch of which of the following artery? Is it inferior epigastric, external iliac, internal iliac, or obturator? So according to you, which is the correct answer? So yes, mark your answer. Okay, tech world is telling yes, ma'am. Okay, yes, sure. Question number 4th, A, B, C and D, which is the correct answer? Accessory obturator artery is a branch of which artery? Whether it is inferior epigastric, external iliac, internal iliac, obturator. Fourth A. Kumaran is telling it's A. What about others? Okay. Accessory obturator artery is a branch of B. Shweta is telling it's B. Okay. Okay, so firstly, okay, now Kumaran is telling it's B. So I think he is confused between A and B. Okay, A and B. What about others? So that I can give the answer now. Okay, so let me explain. Harini is telling it's A. Okay. Now let me explain. Actually, the correct answer is A. Correct answer is A. Accessory obturator artery is actually the branch of inferior epigastric artery. So in common terms, I just want to describe like the abdominal aorta divides into common iliac artery, right and the left common iliac artery. And this division occurs approximately at the level of L4 lumbar vertebra. Thereafter, what happens at the level of sacroiliac articulation joint, the common iliac artery divides into external and internal iliac artery. Internal iliac artery is the major blood supply for the pelvic structures, and external iliac artery is the major blood supply for the lower limb. So inferior epigastric artery is a branch of external iliac artery, but in the option directly inferior epigastric artery is given, so A is the correct answer. And actually it is important to know about accessory obturator artery, because normally this accessory obturator artery, which is a branch of inferior epigastric artery, lies onto the lateral aspect of the lacunar ligament, but at times it can have a relation to the medial aspect onto the lacunar ligament. And we know in cases of repair of femoral hernia, we want to enlarge the ring, and for enlarging the ring we can't go laterally because femoral vessels are lying there, so we will enlarge it on the medial aspect. So at times this anatomical variant should be kept in mind before performing the surgery, because at times it can be related on medial aspect, and aberrant cutting of this artery or ligating the process, what will happen, there can be bleeding in this area. So this is a quite important anatomical landmark, should be kept in mind. So yes, let me explain you firstly, and then I will show you the abnormal obturator artery also. Okay. So pubic branch of inferior epigastric artery. Pubic branch of inferior epigastric artery contributes to accessory obturator artery. Now, normally the obturator artery is a branch of which artery? Normal obturator artery is a branch of which artery? Anyone? Normal obturator artery is a branch of which artery? Okay. Anyone? Aorta divides, abdominal aorta divides into common iliac artery, and this division occurs at the level of L4 lumbar vertebra. This is also important. And the common iliac artery, yes, absolutely right Kumaran, a common iliac artery again divides into external and internal iliac artery. And external and internal iliac artery, this division occurs at the level of sacroiliac articulation or joint. This division occurs at the level of sacroiliac joint. Now we know that normal obturator, when we talk about normal obturator artery, so normal obturator artery is a branch of internal iliac artery. but abnormal or you can say accessory obturator artery is a branch of internal iliac artery. So, it is a now normally what happens, inferior epigastric artery is giving a pubic branch which forms an anastomosis with the obturator artery. Okay. At times this pubic branch of the inferior epigastric artery is quite large, the anastomosis is large, and it will replace the actual obturator artery, and in that case it is called as accessory obturator artery. Okay. So, let me just show you one diagram, okay, of internal iliac artery important branches. Everyone, the image is clear? Okay. So, yes, yeah. Now, you can see this is the abdominal aorta, bifurcation is occurring into common iliac artery. Again this will be the two sides common iliac arteries. These are the common iliac arteries on both the sides. Now, again the common iliac artery is dividing into internal iliac and that of external iliac artery. External iliac artery and that of internal iliac artery. So, we are in this diagram, the internal iliac artery division has been shown. So, important branches from anterior division is umbilical artery, obturator artery, the both vesicle. So, superior and inferior, vesicle means pertaining to urinary bladder, superior inferior vesicle is there, internal pudendal, inferior gluteal. All these are the branches, middle rectal, vaginal, uterine artery, all these are the branches of anterior division, 3 branches from that of posterior division. What are they? Iliolumbar, lateral sacral and superior gluteal. Okay, iliolumbar, lateral sacral and superior gluteal. So, yes, it is clear now. Now, what I have explained, I just want to show you the diagram for this. So, in this diagram everyone can appreciate the abnormal obturator artery. So, here in the diagram the abnormal obturator artery has been shown, and what you can see, this abnormal obturator artery is lying in close relation to which ligament? Lacunar ligament. It is lying in close relation to which ligament? Lacunar ligament. So, here you can see here this triangular ligament which I am highlighting here is the lacunar ligament. Okay, this triangular ligament which you are seeing is the lacunar ligament, and you can see that abnormal obturator artery is lying over which lacunar ligament. My dear friends, if you will see this strangulated hernia, in that case an emergency operation has to be performed. Why? Because the surgeon wants to reduce this hernia and put back the strangulated loop, strangulated loop has to be put back into the cavity, abdominal cavity. For this they want to enlarge the femoral ring. So, that cutting can be done medially only by cutting which ligament? Lacunar ligament. Why? Not laterally, because femoral vessels are lying laterally. Femoral vessels are located laterally. So, at that point, if it is not kept in mind that abnormal obturator artery can at times be present there, it can lead to enormous bleeding. Why? Because when the surgeon will enlarge or cut the lacunar ligament on the medial aspect, as you can see here, which artery will be cut? Abnormal obturator artery, and abnormal obturator artery is a pubic branch from inferior epigastric artery. So, is it okay everyone? I think it's okay. Let's move on to the next MCQ. Any doubt you can ask me? Any doubt? Yes. So, let's move on to the next MCQ, that is MCQ number 5th. Yeah. All of the following are example of traction epiphysis except. All of the following are example of traction epiphysis except. A. Mastoid process, B. Greater trochanter of femur, C. Lesser trochanter of femur, and D is deltoid tuberosity. So, yes, take your time and mark the correct answer. Mastoid process, greater trochanter of femur, lesser trochanter of femur, and deltoid tuberosity. All of the following are example of traction epiphysis except. Question number 5th. Okay, so I got Selvan has given Bharti Selvan C, lesser trochanter of femur. Okay, what about others? C. Okay, again C is the answer. Okay. So, no idea. So, should I go for explanation or wait for your answers? So, let me explain this MCQ. Actually, the correct answer is, so the correct answer here is deltoid tuberosity. Okay, it's not an example of traction epiphysis. Okay, first thing is that you have to understand what is traction epiphysis. So, this is the epiphysis which is seen in the long, it is seen in the bones, long end of bones, and actually these are the areas where there is traction. It's different from the pressure. Pressure epiphyses are also formed at the junction or the bone part which is actually taking part in the joint formation. When we are talking about traction epiphysis, is the part of the bone which is not involved in any kind of joint formation, but these are the reason which is assisting in weight transmission, like it is giving attachment to the muscle, tendons, ligaments and all. Okay, so that is very important. And here if we see the greater trochanter of femur, option B, so lesser and greater trochanter of femur is absolutely an example of the traction epiphysis, and also the tubercles of the humerus are examples. So, these are all example of traction epiphysis. Here also in the mastoid process there is pull of ligaments and the muscles. So, it is also an example of traction epiphysis. But when we talk about deltoid tuberosity, the location of deltoid tuberosity is in the diaphysis part of the long bone. So, it is not an example of traction epiphysis. It can't be the example of traction epiphysis. So, few points about traction epiphysis, please note down. Traction epiphysis. Traction epiphysis is seen in long bones, non-articular part. It is lying where? It is located in the non-articular parts, not involved in joint transmission. So, it is not involved in joint formation, not involved in joint formation or any kind of weight transmission, unlike pressure epiphysis. When we are talking about pressure epiphysis, it is involved in weight transmission. Traction epiphysis is supported. It is the area which is supporting. It forms a support for tendons, ligaments. Means it is formed due to the pull of muscle, tendons and ligaments, and the examples are like tubercles of greater and lesser, tubercles of greater and lesser, tubercles in case of humerus bone, trochanters of the femur bone, and one more thing is important, that always the traction epiphysis will ossify later than the pressure epiphysis. So, please note down this point also. Traction epiphysis ossifies later than pressure epiphysis. Now, my dear friends, the correct answer is deltoid tuberosity. Why? Because deltoid tuberosity can't be the answer, because deltoid tuberosity is present in which part of the long bone? You must be knowing, it's present in the shaft of the humerus bone. Deltoid tuberosity is the area where the deltoid muscle is inserting. So, it is present in the diaphysis part, it is not present at the ends of the bone. And epiphysis means it lies in the ends of the bone. So, epiphysis is the answer. So, clearly we can say deltoid tuberosity is not the correct answer. So, few examples and have been shown for different types of epiphysis: pressure epiphysis, head of the femur, traction, lesser and greater trochanter. So, also the other is atavistic epiphysis, which in the case of lower animals it's a separate bone, but in case of human beings the separate bone has fused to become a part of one bone. Like the example are coracoid process of the, we have got coracoid process of the scapula, we have got posterior tubercle of talus. Aberrant epiphysis means abnormal position. So, that is abnormal epiphysis location at the head of first metacarpal. So, these are certain example of epiphysis, and we have done with this. Now, for today's session, These are the MCQs which has been done. Again, I will come tomorrow at the same time. We will have a session on 7:30 p.m. Before ending the session, free live sessions on the Unacademy platform. Those who want to see my free live session. So from 9 p.m. also High Yield MCQ session I will take 9 p.m. in the Unacademy platform special class. So you can attend that session. And this is the schedule of my upcoming session. So it's already today also I have taken one 11:30 am session. So those who want to revise the cartilage histology, you can see this session. The link will be provided in the group. It is on the Let's Crack NEET PG group. It's also in the Unacademy group, Telegram group, also in my own group. So High Yield Anatomy MCQ discussion will be taken 2 times in a day. So one at the YouTube, that is YouTube में 7:30 p.m. and Unacademy High Yield में it's 9 p.m. Thank you Kumaran. And conceptual anatomy is 6 p.m. again 11:30 am in the morning. I will take one conceptual small topic of your choice. Some of the students has told me to cover up head and neck important points also. So I will come up with the important topics of important reason, which is basically very important to crack the entrance exam. So this is the Anatomy High Yield MCQ session, 9 p.m. session. Unlock code is ANAT10. Okay, all the links will be provided on the Unacademy platform. Also, it will be provided in the Let's Crack NEET PG Telegram group, also in my own group. Okay, and you can use the code ANAT10 for unlocking. And also, if you want to take the subscription of Unacademy, conceptual anatomy topics are these. So tomorrow's session is venous drainage of lower limb. 6 p.m. timing is there. 6 p.m. is the timing for the venous drainage of lower limb. So 2 High Yield Anatomy MCQ discussion. So one at 9 p.m. other at 7:30 p.m. So do present for this session, and those who want to have a topic wise discussion, they can join me for the 6 p.m. and 11:30 am session. Okay. So this is my code which can be used if you want to take the plus subscription, or you want to see the free sessions on the Unacademy platform of any of the educators or any of the subject. All the best, keep studying. Thank you so much. We will meet exactly for 7:30 p.m. tomorrow with new MCQs, and also 9 p.m. session. If you want to join me on the special session on Unacademy, you can join me. All the best. Thank you so much. Thank you.